Hello, ladies and gentlemen. Thank you so much for choosing Equinoxe Radio Multimedia to get yourself informed on health-related matters. For presentation, I am Immaculate Fogwe. Today, Cameroon joins the world to commemorate World Oral Health Day. According to the World Health Organization, globally, nearly 3.5 billion people are affected by oral diseases, with 2.3 billion suffering from tooth decay and 796 million having severe periodontitis. What is it all about? How can we better prevent this condition from affecting a good number of the population? That's what we'll be answering on today's edition of the program, You and Your Health. Stay sticked because we have a guest for you. But before introducing my guest of the day, ASHU Micheal is here with us. Hello, Lucy. It's a pleasure being with you always.
Hello, Immaculate. It's always a pleasure. And good afternoon to all our listeners and viewers out there.
My guest today is someone special. He's known as Professor AGBORg ASHU, a professor of community dentistry, dean of the Faculty of Dentistry at the Université de Montagne, and director of the Cabinet Dentaire, found in Bonamoussadi, right here in the city of Douala. Good day. It's a pleasure having you on the program, Professor.
Good day, Immaculate. Good day, Lucy. I'm happy to be here today.
Pleasure.
It's a pleasure being with you for sure. You are a professor who has been into this profession for several years. We'd like to know from you, what are some common oral health issues you have noticed while practicing as a dentist?
The most common oral health issues that we can see in our environment are dental caries, what we call tooth decay. Mm-hmm. We have periodontal diseases that affect the tissue supporting the teeth. If you start seeing your teeth shaking, it's very, very common these days. We are also seeing a lot of people who present with teeth that are not well arranged, what we call orthodontic diseases. So apart from that, we see some people who present with cancer these days. People are smoking a lot of cigarettes, and when they smoke and take alcohol at the same time, they start producing some changes in their mouth that at the end up as cancer. And then today, a lot of diseases, chronic diseases are increasing, and it comes along affecting their teeth. And people with diabetes, hypertension, they present with different types of manifestations, like periodontal diseases. Dental issues also affect pregnant women, so it goes across all age group in the community.
Looking at dental caries, one of the main reasons why people are suffering with this condition is because of the way or maybe the fact that they don't brush their teeth, or maybe they don't use the right techniques when brushing their teeth. Can you tell us, what is the best technique of brushing the teeth, or let's say floss?
The best technique of brushing your teeth is, it starts with the type of brush you use. Mm-hmm. There are three types of brush, bristles of the brush. You have this hard, you have the soft, and you have the medium. Mm-hmm. For ordinary people, you are supposed to use the medium texture of brush bristles. When we talk about bristles, it is this part of the brush that brushes your mouth. Mm. So also the soft one is also good for people who have sensitive teeth and people who are having bleeding gums. And when you have a bleeding gum, it means that you're having some sort of periodontal disease, which we call gingivitis. So the toothpaste also matters. A toothpaste with fluoride is also important when you are brushing your teeth, because the fluoride, when it's applied on the surface of the teeth, it reinforces the teeth and makes the teeth resistant to tooth decay. And then the way you manipulate your toothbrush on the teeth. You're supposed to brush from gum to teeth. For example, if you have your toothpaste on your toothbrush, you don't need so much toothpaste. You just need a small amount of toothpaste, what we call pea size, just like the size of granite. You apply it on the outer surface of the teeth. You apply it in the inner surface of your teeth. And then you apply it on the biting surfaces, and you do that up and down. And then when you are brushing, you put your brush down, and you just do a small rotatory movement, C-shape, like this. You just do it 5 times per tooth. You see what is happening here is that the toothbrush massages the gums, increases the blood circulation, and carries food particles that are in between the teeth upward to the outermost part which you brush. Right. So you do that outside, and you do it inside, and then you brush the biting surfaces. Most of us we forget to brush the biting surfaces, and that is where we develop dental caries. When food stays there, bacteria will act on the food particle and produces acid, and it's the acid that will destroy the tooth substance. So when you brush down, you brush up the same from the gums to the teeth, from the red to the white. You do the same thing outside, inside, and then on the biting surfaces. And the last thing you do is to brush your tongue. Because the surface of the tongue is very, very rough, and many, just like the surface of a towel, and many bacteria stay there and increase their activity. So you have to brush your tongue to remove the bacteria. And then after brushing, don't forget, you have to spit out the excess toothpaste. Don't rinse. Because if you rinse, it's just like you painted a wall. The wall is not yet set, the paint is not yet set, and you pour a bucket of water. That fluoride, that is in your toothpaste, when you rinse immediately, you wash it out. That is why many people brush their teeth, but they eventually develop dental caries because they rinse their mouth immediately with water. So what you are supposed to do is just spit out the excess toothpaste, and then you just leave it like that. The fluoride in the toothpaste and some antibacterial properties in the toothpaste will help to protect your teeth.
Okay, Ima, before we go to the next question, we'll give the contacts for those who like to join us on today's edition. We have 670-547049, 670-547049, or 656-622222 at the end. I repeat, 656-622222 at the end for those who have questions and would like to ask the professor on this. And now back to you, Professor. We'd like to know, what are the benefits of using an electronic toothbrush or maybe a manual toothbrush?
Okay, first of all, we have to look at the efficacy of the two. Is there any difference in efficacy? No. They can, if you actually use your brushes well, whether it's electronic or it is manual, you can achieve the same results. But the advantage of using electronic toothbrushes is that people cannot actually manipulate their brush. It is easy to say you have to start brushing from the gum to the teeth. It is not easy to practice, to put it into practice. So people who can actually manipulate their manual toothbrushes will achieve the same results with somebody who's using an electronic brush. But the electronic brush has the advantage in that the maximum time of brushing is 2 minutes. Some of these brushes have timers that you can brush for 2 minutes, and after 2 minutes it stops. Another thing is that it has this type of rotating movement that it can actually massage your gum easily and helps the circulation of blood in your gums. And then also people who don't have good dexterity, who cannot grip a toothbrush very well, in the electronic brush you see the part that the battery is inserted is big, so you can actually grip it well, and you can use it to brush. I think those are just the advantages. The difference is not that much.
And you made mention of smoking as some of the factors that can lead to maybe a tooth decay or maybe a cavity. Now, we would like to get some other factors that can equally lead to, or how we can prevent tooth decay or cavities.
Preventing tooth decay is very, very easy. As she said earlier, 3.5 billion people are affected by dental disease, and majority of these diseases are just tooth decay and periodontal disease. That is diseases affecting the gum.
We'll take this caller who's on the line. Hello.
Hello, good afternoon, madam.
Good afternoon, sir. Your name and where you're calling from?
I am Mr. ASHU.
Okay.
Calling from Decay.
Thank you, welcome, and your question?
My question is, I just learned from one of in social media that fluoride is a product that when you are using it ends up giving you cancer. I don't know how far, since the doctor is the dentist, can he tell us something? Because I just learned from him to the extent that each time that I want to buy my toothpaste, I will always look if it is. But fluoride is the main product of toothpaste. So I was thinking disturbed when I heard that message. Can the doctor verify us?
Thank you very much.
Okay, thank you very much for that interesting question. What I would like to tell you is that any medication is dosed. very, very high levels of fluoride have not been shown to produce any cancer. This is what we call in medicine today evidence-based medicine. That is, you have to medicine that is based on proofs. Many studies have been done in Africa, where we live immediately, and abroad, and it has been shown that fluoride does not produce cancer. If fluoride produces cancer, how many people in the whole world use fluoride toothpaste? How many of them have developed cancer in their mouths? What is happening today with cancer in the mouth is our habits. We eat a lot of things that our parents were not eating in those days, and we are developing cancer. We smoke a lot of cigarettes. Those were not cultures that our forefathers had. But today, we are indulging into this through peer pressure and all the rest. So there's no study that has shown that fluoride causes cancer. Instead, fluoride reinforces your teeth and also reinforces your bone. The normal concentration of fluoride in a toothpaste is supposed to be 1,000 parts per million. And that quantity is enough for you not to develop any disease. What we know about the side effect of fluoride is that if you take fluoride in excess, you can develop what we call mottle teeth. That is, your teeth start becoming white. That teeth will become stronger than the rest of the teeth in the mouth. And we see that in the northern part of Cameroon, where people drink water, groundwater, where there's excessive fluoride in the water. We did a study in Gaoundé and Marwa, and we realized that many people, their teeth are brown. It's because they take water that has a lot of fluoride. And we analyzed the water as well in Cameroon, and we realized that these people are taking fluoride up to the amount of 5,000 parts per million. Wow. While the one in the toothpaste is around 1,000 parts per million. And for children, it's even reduced to the quantity of around 350 to 400 parts per million. Okay, if fluoride can cause toothpaste, why is it that people who live in that area where the soil has a lot of fluoride and they drink water from this soil, why are they not developing cancer? So that information is not evidence-based.
All right, and Professor, I would like to also understand, because there are some products or chemicals that we buy from the birds. Like you see these people selling in birds, in agencies. They say this is good, this is a good chemical for your teeth. It's going to help to whiten your teeth. It's going to help to make your mouth clean, reduce mouth odor. Is it really good?
There are some products. One of them is what we call shiny.
That will shiny.
Today, young people are influenced by social media. They look at artists from America, from Europe. They have very shining teeth and all the rest, and they want their teeth to be as white as these people. I want to tell you something. The color of your teeth depends on your complexion.
We have another call on the line. We'll get that call and get back to you.
Hello,
good afternoon, madam. Your name and where you're calling from?
I am Madam D. calling from Yaoundé.
Your question, thank you.
Yes, I have a complaint in my own teeth. When I take sweet, later on, it seems I've eaten some ripe mango. Even the sweet toothpaste, I have the same case. So when I brush my teeth, I forget. Later on, I can no more eat anything strong. So I don't know what's the problem.
Okay, you got the question.
No.
Me too, I didn't get it clearly.
She's saying that when she takes something sweet, or maybe she uses a toothpaste that is actually sweet, later on she has difficulties eating. Mostly things are strong, it affects her teeth.
Okay, what she's having is what we call tooth sensitivity. And if you look at the teeth, the part of the teeth that we see outside, we call it the enamel. That part of the teeth is hard and it's not living. But underneath it, there's another part that is a little bit brown, which we call the dentine. It has blood vessels, nerve endings. So when you brush your teeth, it comes back to the question she asked about products that they sell in the box. When you brush your teeth with shiny, it will reduce the outermost part of your teeth, which is called the enamel, and expose that part of your teeth, which is called the dentine, which has nerve endings. So if you are using very hard toothbrush, it will reduce the enamel and the dentine will be exposed. And when you take cold water, it will stimulate the nerves and you start having some sharp pain, which is just like it starts like electric shock. That is what we call sensitivity. And even if you use toothpaste, which is not a sensitive toothpaste, the sensation will increase. If you take something that is hot or something that is cold, the sensation will also increase. So that is the after effect of using those materials I buy from the boss, like shiny. Some of the materials, madam, I've just answered your question. It is because your dentin has been exposed, so you are expected to see a dentist that will put some material there and cover your dentin, and that will protect you from having sensitivity. Okay, going back to what we're discussing, in the boss, you can also have some materials that they use, the cell, that you can use to protect your teeth. Some of these materials are just eggshell that they have grounded into powder, and then they put some detergent into it that it can foam. And when you use it to brush, they can put some charcoal on it. It is harder than your own teeth. So if you use it to brush, then it reduces your enamel and exposes your teeth, and you have sensitivity. There are other products that they say that you can stop tooth decay. All those products, they are not been tested in the clinic, and I don't advise people to get them because they can cause more damage to your teeth than good.
Are there some foods or let's say drinks that can help promote food decay? Specific ones? That
can help promote tooth decay. First of all, you have to understand that the teeth is made of a lot of calcium and phosphate ions. So there are some food that can protect your teeth.
We have another call on the line. We'll come back to that.
Hello.
Yes, good afternoon, madam.
Good afternoon, madam. Your name and where you're calling from?
My name is Mr. Julius from Yaoundé.
Okay, Mr. Julius, hurry. Your question, sir.
Please, I want to just ask whether I'm always brushing with salt. Is that dangerous or not?
Okay.
Okay, thank you very much for your question, Mr. Julius. You are always brushing your teeth with
salt. We have another call, and I will pick that call. We will come to you.
Hello.
Okay,
hello.
Thank you.
Hello, afternoon, madam.
Good afternoon, sir.
Yes, the doctor just explained, and I want to ask this question. There's a toothpaste called fluoride-free toothpaste, which does not have fluoride. When you are using it, doesn't mean you are exposed. That is my question. There's a toothpaste that they call fluoride-free toothpaste. It does not have fluoride. So when you are using that type of toothpaste, doesn't mean that you are exposing your teeth to sickness.
Okay, thank you very much for this question. I'll answer the two questions that have been asked together. The role of the toothbrush and the toothpaste are complementary. When you eat and you stay for a long period of time, like 2 hours, some remnants of the food will stay on the surfaces of your teeth. And what you use your brush is just like when you are polishing your shoe. Yes, you remove the brush, removes these particles that settle on your teeth, which we call dental plaque. And then the toothpaste that you apply on your toothbrush helps to reinforce the teeth. It's just like we are painting the surface with fluoride. So now, some people, because of the education they get, have decided not to go on fluoride toothpaste. That is your personal decision, but from studies, we even did some studies in Cameroon to find out the quantity of fluoride in toothpaste. And we even realized that there are some toothpaste in the market that it is written on the packet that they have fluoride, and there's no fluoride in it. I would advise you to go for a toothpaste that has fluoride because it is protective. It protects your teeth against, and if you brush, you have holes, even if you have holes in your teeth, and you start brushing with toothpaste that has fluoride, that particular hole will not advance, it will arrest. And even if you were having some pain, at the end of the day, that pain will stop. So you see how far the fluoride in the toothpaste can go ahead to help you to avoid dental caries.
Now the next question about salt.
Salt is just like the shiny that we see in our bosses. We call them abrasives. It's just like your iron kucha that you use in washing your pots. That is very, very rough. They are abrasives. What do you do with your iron kucha? You wash the pot and remove, if that pot is made of aluminium, you will remove some outer layer of aluminium with that iron kucha. So salt, if it is not dissolved, it serves as an abrasive. Eggshell that has been ground, it serves as an abrasive. They will always help to actually remove the outermost part of your teeth, and it is not advisable to use them.
Before that call, we're talking about diet, and we're looking at drinks and food that can help advance to decay. What are some of those things?
Okay, first thing is that for your general health, you should get balanced diet. It means that you must have enough carbohydrate, you must have enough proteins and other fibers and all the rest. Balanced diet is very important in the development of the teeth, especially for children.
We have another call on the line. Hello.
Hello.
Yes, sir.
Afternoon.
Good afternoon, sir.
Your name or where you're calling from, sir? Hello.
Yes, my name is Longe Nilis.
Okay, your question.
Yes,
Please, can you turn off your receiver?
Yes, I wish to ask the professor. I have a problem with my molars.
Okay.
So what is the problem, my friend?
Yes, when I drink sweet juice.
Yes.
I drink sweet juice, and at times I take those alcoholic drinks that are sweet. I have problem with my molars.
Does it have a hole?
No hole, professor.
Okay.
I realize that those molars, they shrink. When air is there, and come a problem.
Okay. It's just the same question the first person asked. What you're having there is called sensitivity. It means that how old are you, please?
The color is gone. Yes, it's gone.
Mm-hmm. You just continue.
So you're having what is called a sensitivity, and it's just because your gums have gone down, they have become shorter, and your teeth is becoming longer, and the part of the teeth that is called dentin is exposed. Okay. And that's when you take cold water or hot food and you feel this pain. Going back to nutrition, it is good to take food that has a lot of calcium and phosphate, because those are the substances that form the hard part of the teeth. It's good to take some eggs, vegetables. Those are nutrition that has a lot of calcium and phosphate that can actually help you to produce what the teeth substance is made of, what called hydroxy apatite, which is made of high quantity of calcium and phosphate. Milk is very important for the teeth. For those who are growing, for adult, milk is not really important. Okay. So a good balanced diet is fine. Then for diet that are not good for the teeth, you should not eat sticky food. There's what we call abrasive diets, or diet that can brush your teeth. For example, if you eat something like carrots, apples, they are very good for your teeth because they can actually clean your teeth for you. Coconut can brush your teeth for you. Wow. You know, the sugar content is very, very low. When you take something that has a lot of sugar, the sugar will remain in your teeth in the form of a liquid. Okay. And then this liquid will be digested by bacteria in your mouth and will produce acid, and it's the acid that is going to destroy your teeth.
Time is up. Our technician is already informing us that it's over. 30 seconds. Advice for people who are facing these challenges when it comes to tooth decay.
There's just one simple advice I will give to you. You can put a dentist away if you brush your teeth well. And if you have any symptom in your mouth that you think is just starting, go to the clinic for consultation. It is advisable for you to go to the dental clinic every 3 months to check your teeth, and if there's any deposit in your teeth, you have to do some cleaning, and the dentist is always there to advise you.
Thank you so much. Professor AGBORg ASHU, a professor of community dentistry, dean of the Faculty of Dentistry, Université de Montagne, and a director of the Cabinet Dentaire, located in Bonamoussa in the Douala 5 subdivision. Thank you so much for your time.
Thank you very much.
And equally a big thanks to you, Lucy. And pleasure. Also a big thanks to our technical crew, Jonathan Babula and Bertrand Bonzini. We say a big thank you to you all, and also to our millions of televiewers and listeners. That's all put an end to today's edition of the program, You're in Your Health. Thank you so much for watching and listening. Have a wonderful day in the company of more interesting programs on Equinoxe Radio, of course, television. Bye-bye for now.